Now, welcome back. Now, it's very common to see a surge in aesthetic treatment this time of the year. People want to start the new year looking their best, and over the festive season, they finally have the time to get surgery and the downtime to recover. Also, with a Christmas bonus, they may have the budget. Well, this is according to Dr Kajal, an award-winning plastic reconstructive surgeon, and she joins us on Zoom to tell us more. Dr Kajal, a very good morning to you. I mean, what were some of the most popular cosmetic surgeries of 2022, and what will the most popular ones be for 2023?
Good morning, and thank you so much for having me. So yeah, definitely, new year, new me vibes. Everybody wants hashtag 2023 goals. It's the festive season, so people also have a lot of downtime, and now they also have a budget, right? Because they've got the Christmas bonuses and their 13th checks. So a lot of what we've been seeing recently, in fact, in the last 10 years, not just 2022, is a shift and a change in people, especially our South African people, which I'm so proud of. I'm not just worrying about their faces and their facial features, because traditionally plastic surgery was facelifts and eye lifts and things like that. But in the last decade, there's been a shift towards more body contouring procedures. So patients are very likely to want to invest in their bodies as well. So we're seeing a lot of BBLs, which is known as your Brazilian butt lift. And we're also seeing a lot of mummy makeovers, liposuction, liposculpting. And I think this trend is going to definitely continue into 2023. And I also believe that we're going to see a lot more surging in non-surgical treatments as well in 2023, because we are getting some great technology out there that, combined with surgery, enhances your aesthetic outcomes.
And I mean, how much do people spend on cosmetic surgery per year? And are the rumors true? You know, you hear how people say it's addictive. Once you go under the knife once, you're going to keep going back because you're going to see, all these, errors that you need to fix.
So definitely, I must say one thing, and I'm so glad that you asked me about cost. Because a surgery, remember, is something that you do under sterile technique with an anesthetist, a surgeon, a qualified plastic surgeon, a assistant surgeon, as well as theatre consumables, drugs, gases, dressings, all of that stuff. So if you're looking at a straightforward standard liposuction, for example, you're expecting to pay anywhere between 50,000 Rand. With additional treatments and surgical stitching and suturing, you can go anywhere up to 150 to 200,000 Rand. And this is something that I think people should be so very aware of. If something is much cheaper than that, please be very aware, because you get what you pay for. And also, if it's too good to be true, it generally is. If a patient or somebody is going to somebody who is not a qualified plastic surgeon offering plastic surgery procedures, please be very aware. As a patient, it is your right to be discerning. It is your right to ask, and it's your duty to ask about the relevant qualifications of your aesthetic provider. And it's also important for you to ask about before and afters and their experience in the field. So just be aware of costing. It's actually very, very important. It's something that you really want to make sure. So globally, the trends are rising, and we're definitely getting a surge in aesthetic treatments. And this is something that I think patients should be very, very, very aware of.
And what are the dangers of that as a surgeon, that, there's an increase, but, you are going to get those in the industry that are, not exactly qualified to do the job the way most surgeons are. Are you seeing also an increase in that too, where you are supposed to fix what another person couldn't?
So that's to answer the second part of the question, which is why we see so many repeat procedures. We actually do. We see a lot of repeat procedures. And basically what happens is that a patient can have a repeat procedure for very many reasons, okay? The one could be they may have had a complication, an unforeseen complication, like a little stitch opening up, or a hematoma, or a small infection that sometimes is unavoidable. Okay, those are usually noted complications that can happen from any surgery, even in the best hands. And that's something that we aggressively counsel patients on, to make sure that they know that no procedure is without risk. Anything, it could be elective surgery. So that is something that you have to have informed consent about. So with regards to repeat procedures, complications is one of the reasons we see a lot of that in. And the other one is patients that have unrealistic expectations, right? If you think a surgery is just going to fix everything, and your kitchen sink, you're really mistaken, because you've got to also put in the work. A lot of these operations, like liposuction, will require at least 3 to 6 months of sweating to decrease. They also have to have you on a reasonable diet and exercise plan. And it doesn't mean that if you had the surgery that now you can just eat whatever you want and do whatever you want. The compliance with pressure garments and with diet and exercise is unfortunately still very important. Compliance and commitment is so important. And yes, the last reason is if you are going to a provider that is not experienced in doing what they're doing, or is not a qualified plastic surgeon performing plastic surgery, you are most likely going to end up with a recurrence or a repeat procedure because your results may not be desirable and your complication rates statistically are higher. So that is just something very, very important. The addiction aspect that you touched on, I think, is also so important because as plastic surgeons, we are trained to look for these red flags, right? When a patient walks into your room, you're actually assessing them from the time that they walk until the time they sit down and everything that comes out. So if somebody's doing something for the wrong reasons, for, bringing back a lost lover, or for, X, Y, and Z reason, or to cure their depression, you know what I'm talking about. So, those are the reasons we're like, hey, wait, hold on, these little other things in your life need to be sorted out first. If you're coming and you're doing this for you because this has been an issue for you all along, or you're a personality type A and you're like, you know what, I'm so worried about this. Sometimes it's my duty to say, sorry, there's nothing there. From the naked eye and from an objective perspective of somebody who assesses and is trained to assess beauty, there's nothing wrong with you. Or, sometimes you say, well, this is actually what you need. You may be worried about your nose, but your cheeks and your chin is actually, something that needs definition. If we basically, refine this, the rest of your face is not going to balance. So sometimes it's our duty to counsel these patients so they don't become addicted. Because the last thing we want, and I always tell my colleagues this, plastic surgery is such an unforgiving field because unlike our other specialists, nobody knows what they do. They stitch it up and they close it and then it's all done. If you're doing neurosurgery, it's in the brain and it's all stitched up and it's all done, right? Maybe very complex, but with plastic surgery, everything is there. So you're a walking advertisement for your plastic surgeon. We don't want you to look bad, trust me. So we don't like addicts.
Yeah. And I suppose, the recoveries are also different, the different times for the different procedures. What is the longest that people take to recover? For instance, I think I spoke to somebody who was saying that it takes 8 weeks after a BBL. You can't sit down for about 8 weeks or something like that along those lines. What are some of the different recovery times that you see?
So it really just depends. It's so patient specific, and it can literally range from 1 day if you're doing a liposuction on a male patient that just wants to get rid of that little dad bod beer belly, right? I've had patients when we check up on them overnight or later, they've gone out to supper, they've got little drains in them that they're walking around with, and they're fine. And then I've got patients who are literally will be in for 2 to 3 days in bed because of the pain. So the first thing is pain threshold. Everybody's is different. And you have to budget really according to the procedure. Are you doing a combined procedure? Are you just doing, for example, you said a BBL? Are you doing lipo add-on? Are you doing a full mummy makeover with a boob job, with tummy tuck? And even if a lot of ladies don't talk about the stigma associated with the labiaplasty, but it's something so life-changing for women, right? So often people will have combined procedures. And then, yes, you could range anywhere between 2 to 4 weeks of downtime. It really just depends. A breast reduction would take about a week and a half to 2 weeks. And also patients' comorbidities greatly affect this. So if your patient is diabetic or insulin resistant, they're more likely to develop wound healing issues, or their wounds are more likely to develop a bit more delayed, right? So those patients, you will budget for a bit extra downtime. So each patient is very different, but ballpark, I would say anywhere between a day right up to 4 to 6 weeks.
And, before I let you go, why is the festive season such a popular time for cosmetic surgery?
Yeah, so it's a booming industry, especially during the holidays, because I actually have this little meme on my Instagram, which is called the Barbie Surgeon, Touch Plastic Surgery, and it's a picture of 2 Barbie dolls, and the one is basically this melted, disheveled Barbie, and that's basically me during the holidays because I have no time to take care of myself. And then the next one is my patient, who looks amazing and glam and beautiful, and they're just like glam Barbie. And the reason why I have that is because it is such a popular time for plastic surgery and aesthetic treatments. And the reason for that is because it's the new year, new me, people are motivated to get going. They also have the downtime during the holidays. A lot of people don't get leave during the year. And the very last thing is people have their 13th checks. They've got their Christmas bonuses and they've budgeted for the year and they've saved up for this. And so I think that's the reason why it's such a popular treatment during the holidays. So during the holidays is not a time for me to actually have a break.
All right, Dr. Kajal, thank you so much for informing us. Thank you so much for talking to us. Good luck with your, cosmetic surgeries that are coming up, and have a fantastic festive season. She was talking to us about the cosmetic surgery industry in South Africa, and more specifically, the increase in demand for cosmetic and procedures over the festive season. All right.